So now we will be going through the part 2 of this module. I'm Brigadier Punita Avnesh Sharma, an alumnus of College of Nursing FMC. Presently, I'm employed as a technical director with Japaigo, India. I have around 40 years of educational and teaching experience in military nursing service in College of Nursing, and my encounter was with digital health when, as a Brigadier Southwest Command, we have to educate our healthcare workers in all categories. I have developed a Disha platform, and from where we trained multiple times, multiple people into the COVID related activities, precaution, and preparedness. Going into detail about what is the benefit of digital health in public health, how this role of health and athletics, what it is, and what is its role. And we also may like to see some case study, uh, how nurses can contribute in this data driven decision making. We also will be introducing how data is collected, analyzed, and improved patient outcome, healthcare system, policy. A key highlight will be the case study on how data analytics played a major role during COVID-19. So this section, let us deep dive into digital health technologies, go beyond hospital and clinic to strengthen public health at large. Public health is a real health facilities which is there for grassroots Indian who are residing in a villages, remote areas where nobody wants to go, nobody wants to work. Let us dwell upon what are the benefit and how this technology will be useful, beneficial. We have seen few like EMR, telemedicine, patient portal, and various innovation which has been brought about by way of apps, wearable device, and point of care diagnostic. What are the advantage of these digital tools and how this can help in a broader sense in largely policy decision and new program rollout in the India. So when we, in this slide, we'll be seeing about benefits of digital health in public health. As we have already seen, this has become a game changer in public health. We will go into 6 areas where it is making a difference, which is in the form of improved accessibility, enhanced patient care, increasing efficiency of the staff, improving nursing education, also giving a lot of inputs about the research and policy making and health analytics. How it is helping improve accessibility. Let us begin by understanding of this important area. Traditionally, the patient from the remote areas and underserved region faced lot of difficulty in reaching healthcare. And if it was reaching also, the lot of out-of-pocket expenditure was taken. Now, digital health is a tool. This barrier is significantly reduced by using this. Telemedicine, telenursing allows health professional to connect with the patient and their colleagues in taking decision for patient health monitoring and Patient don't have to walk. Take an example. Suppose a stroke patient comes, he is there at home, he is not able to walk, but a nurse monitors his progress via video calls, which can be connected on even on WhatsApp or an internet call, and guides them about physiotherapy exercise, which taking medication, also sees whether the diet which is there, which they have recorded and analyzed, whether she is able to say. Now it has got two function. Patient gets this advantage sitting at home, and healthcare professional also don't have to invest her time in commuting to the patient's home. It is digitally available real time. So see the advantage win-win situation for both. Thus, improving accessibility is a major factor in improving health outcomes. It also enhances patient care. When a high risk pregnancy is identified using digital tool, which gets integrated by Anmol app by ANM, GNM, who are there at the ground. And from there, the pregnant woman is encouraged to go for all 4 antenatal checkups and also go for high pregnancy clinic. And it also gives a access each pregnant woman monitoring, tracking, and managing with the patient doctor, patient healthcare provider access together. This helped us in bringing down our MMR significantly low, and we are very near to achieving our SDT goal. This also happens, gives a lot of reminder and alerts because the safe limits are set in the app. So as soon as it crosses whether lower or upper side, there is a beep or there is an alarm. So we are able to take immediate action, and this is there in our mind. This also helps us in monitoring patient's condition. Very successful example is Anmol app, which immediately notifies ANM or GNM about high-risk pregnancy and improves the antenatal checkup pregnant woman. It also brings down our neonatal intervention, and the pregnant woman can be given a timely referral to the healthcare facility where she is individualized care is provided to her. It also helps increased efficiency of staff by seeing that person is recording all the data in an app or patient's electronic record. She don't have to write. It is already drop down menus are there, and she just clicks on this. So the time is saved, and this time can be utilized in giving care to the patient's bedside or reaching out to more number. This also helps in the immunization registry of the under 5, where the missed cases can be minimized. It also reduces the manual record keeping time, thus minimizing error, and also gives a chance to later on review and see our own performance. So performance-based incentive also can be given. It also helps in reduction of a administrative burden, and their time is saved, the evidence are generated, and it is also minimizes various error. Next system is, which is very dear to me, is improving nursing education. Now, imagine as a individual nurse, when you are in your pre-service, you are undergoing your nursing course. You are so scared, like if you are able to perform venipuncture on the patient or not, how painful it will be. What will I do? Imagine some of you, your first encounter in a labor room. When you are seeing first time delivery, you don't know how to hold that baby. But all this experience can be given to you in the form of AR, VR, and digital simulation. Now, when you practice this into a safe environment, you are able to see what decision you are taking. Different simulation scenario your teachers or educator can create. This gives you a further confidence building, which is a very, very powerful tool. And it is also very important in today's time where the patient is very conscious. He or she wants to get a care by a trained person. So this helps in bridging the gap between theory and practice. So this is in the form of improving your practical skill, your confidence, your decision making. And if it is done in a very, very methodical way, systematized way, dependency on the real clinical area can be minimized. So we can conserve the resources and thus patient safety also can be improved. Next, we will look into how it is helping us in research and policy making. Digital health is not just about patient care. It plays a major role in shaping public health policy. Using digital uh, tools, which is real time, we can collect and track health system monitoring, trend analysis, and evaluation of healthcare outcome. More importantly, digital health enables decision-based making, which is evidence-based, and also this can be identified by analyzing data from various hospital clinics, which type of illness is prevalent in which area. And the state health department, like if we take example, a state health department can use digital analytics to track and respond to disease outbreak by monitoring hospital data. Like the patchy pocket epidemic which occurs in a certain area can be controlled by seeing trend of healthcare facility utilization and patient inflow. One more benefit is there when you are able to get this digital devices. The district immunization officer is able to monitor the storage device, the temperature, where the breakdown of electricity has taken, how it is. So the efficacy of immunization material or vaccine also can be improved. Further, the supply chain management also can be improved by this policy making decision, because when we find there is a gap between the no stock or low stock to the replenishment of this stock from the central store in a state or in a district. So this type of preventive measures can be taken. This is a overall patient care management, healthcare delivery improves. In research, this is said to be a very powerful tool in generation of evidence. So this data retrospectively, if we analyze, we are also able to build our own programs, new program, and the old program can be modified. So these are very, very powerful tool by helping this digital data. Next, we will look into health analytics. This is a powerful application of digital health that uses tools like artificial intelligence and big data to improve public health outcomes. We analyze disease outbreak, assess patient risk, and anticipate resource needs, enabling proactive and target intervention. It also supports real-time disease tracking, epidemiological research, evidence-based policy, utilization of hospital, and also track about patients' readmission rates. We also can analyze EMRs, or also we can flag high-risk patient and guide them to take appropriate follow-up care to avoid unnecessary hospitalization. At the same time, finances of the public health system, state or at the national level, can be utilized in a more effective way. So, money is properly utilized and used where it is most needed. Now we have seen how digital technology, what it is, how it is evolved, and how it is further helping us to get into our better and better healthcare delivery, supporting healthcare professionals' self-development, their education, and overall aim of patient quality improvement. With this, I thank you all to stay connected with us, and it was a good journey. Thank you.
Hi everyone, I'm Dr. Srilekha Rajesh and I will be continuing from here. I currently serving as Professor cum Vice Principal at Grand Medical Foundation, Thermigrand Institute of Nursing Education, Pune. I also hold the position of Dean Faculty of Nursing at Maharashtra University of Health Sciences, Nasik. Let us now move ahead and explore the topic of health analytics in greater detail. We now begin an important topic, that is health analytics. This session will help you to understand how data is being used to make smarter, faster, and more accurate decisions in healthcare. Let's make a moment to think about this question. Every time we record patient data, it can do more than just fill a chart. Describe two ways in which the healthcare data could be used. Introduction to Health Analytics. As defined by NHSRC, the health analytics is a process of collecting, analyzing, and interpreting large volumes of health related data to uncover meaningful insight. Now, why it is important? By using health analytics, we can identify patterns and trends within the data. For example, the changes in disease incidence or treatment outcomes. This information helps us do several things. We can predict potential disease outbreak, improve the way the patients are treated, and make more informed, evidence-based decisions when it comes shaping healthcare policies. In short, health analytics is about turning complex data into smarter decisions. Before we move on, let's explain three important terms often used in health analytics and public health. The first one is public health. Public health works to keep people healthy by stopping, controlling diseases, encouraging good habits like healthy eating and exercise, and making healthcare services better for everyone in the community and the country. The second is the population health. It focuses on collecting, analyzing the health data to improve the well-being of specific groups within a community. By identifying trends, risk, and health needs, the healthcare providers can design targeted interventions, promote prevention, and deliver more effective, personalized care to improve outcome for entire population. Then the third one is evidence-based public policy, that is EBPP. It means making and applying policies using real data and research, focusing on facts instead of political opinions or ideas. Elaborately, we will learn about public health analytics. Public health analytics looks at the big picture. It helps us understand and deal with health problems that affects whole communities, not just one person. Public analytics helps us understand and solve health problems in communities by studying data about diseases, their environment, and the people habits. It involves analyzing the data on disease incidence, environmental factors, social determinants of health, and health behaviors. This helps to create better health policies, prevention programs, and ways to handle health emergencies like epidemics. For example, during the COVID-19, the IDSP collected the case data from hospital and testing centers and shared it from local to national level. This helped quickly find hotspots, send resources where needed, and plan lockdown and vaccination late better. Next one is population health analytics, focuses on specific group like young children or elderly instead of whole society. It helps to find the health trends in these groups by looking at disease rate, healthcare use, and outcomes. It also shows health gaps between groups and helps to create targeted solutions. For example, the ICDS program uses digital tool to track children health in Anganwadi centers, making sure malnourished children gets timely help. The third one is evidence-based public policy, that is EBPP, uses data and research to guide healthcare decisions and policies. It looks at real patient records and studies to improve care and make better rules. It focuses on what works best for each patient, not just general policies. For example, if you look at the hospital, may use the past data on pneumonia to choose the best antibiotics based on what works for specific groups. This way, the decisions are based on facts, not guesses or politics. During COVID-19 crisis, India faced challenges like testing, limited contact tracing, and few resources. To help, the government launched the Arogya Setu app. This became a key tool in India's digital health efforts. The app used Bluetooth and location to track exposure to the virus. It allowed users to assess their symptoms, stay informed with updates, and get personalized health advice. The main goal of Arogya Setu were to help with contact tracing, share health advice, and let users check their risk and symptoms. Let us see how the Arogya Setu app worked in real life. The first one is contact tracing. It used Bluetooth and GPS to track users' movements and alert them if they were near someone who tested positive. This helped to find hotspots and control the spread. The second is health updates. The app gave trusted COVID updates, reduced fake news, and sent advice based on each user's profile. The third is self-assessment. Users could check their symptoms. If at high risk, they were guided to nearby testing centers. All these features help to make quick decisions and ease the pressure on hospitals. Let us see what digital health and data analytics achieved during COVID-19. The first one is faster contact tracing. Arogya Setu helped quickly find possible cases and supported targeted lockdowns using real-time data. Second is stronger healthcare support. Early detection reduced pressure on hospitals and resources were sent where they were needed most. Better public awareness. The app educated the people and encouraged actions like vaccination and isolation. Smarter policy decision. The data helped to the government to track situation and adjust plan as needed. Let's do quick check in public health analytics. Take 20 seconds to think about your answer before reading the feedback. We have reached the end of the module 3, that is part 2. First, we look at how digital tools help public health by improving access, decision making, and patient care. Then we saw how data was used during COVID-19 with the Arogya Setu app, helping in contact tracing and planning. Next, in the part 3, we will see how digital health support nursing like managing supplies, referrals, and infection control. Thanks for staying with us. Next, we will explore how digital tools help nurses manage daily tasks more easily and efficiently.